There's a lot of research being done to understand better schizophrenia, but we still don't know the exact cause of schizophrenia. We do understand some of the various risk factors, and if you know what your risk factors are, you can kind of govern yourself accordingly. Knowing the risk factors for schizophrenia is important because it allows you to put what you're seeing into context and to be able to gauge how concerned should you be about presentation. So if there's a family history of schizophrenia or mental illness that puts people at risk, substances they might use, and people who are under extreme stress and duress tend to have greater risk factors. Living in an environment that's not safe or that is stressful, where you're prone to violence or you're exposed to violence, can be stressful. And so the layering of all of these risk factors can make someone increasingly more at risk to developing symptoms. So family history, and specifically a first-degree relative, gives you an increased risk of developing schizophrenia. But all of the things sometimes have to be aligned. So you could have the vulnerability because you have the family history, and then you might be placed in a stressful situation that might kind of unlock or trigger the cascade that happens that has you more vulnerable to having these symptoms. So some of the environmental risk factors that can have someone more vulnerable to developing symptoms of schizophrenia would be things like living in poverty, which lends to you having not as much access to health care, not as much access to healthy foods and healthy and safe environments. Trauma is a significant risk factor. So living in an environment or community where there's a lot of violence, where you might be yourself witnessing violence or, fearful of bad things happening to you. And then substance use in adolescents can affect development of schizophrenia in two different ways. So if they are already more genetically vulnerable or biologically vulnerable, this could be another risk factor that stresses them, that kind of accelerates the process. And then substance use in and of itself can create symptoms because it changes the chemistry in the makeup of the brain, especially chronic use. Just because you have these risk factors doesn't necessarily mean you'll develop schizophrenia. And if you don't have the risk factors, also doesn't prevent you from having schizophrenia potentially. So it's just important to know so that you can be on the lookout and put things in the appropriate context.